So we have Senator Morrell, then Senator Mitchell, then Senator Nielsen. Senator Morrell?
Thank you. Thank you, Mr. Chair, and thank you guys for being here. I have a question as we're talking about developmental services. Was the developmental services rate, the issue included in the governor's January MCO tax proposal? And if not, why was it added now? Who would ever like to address that?
So the governor's budget did not have a rate proposal relative to DDS and wasn't tied to the MCO. We had an MCO proposal that would replace the MCO that's going away, and then also as a funding source relative to the restoration of the 7% for IHSS. In calling for the special session, the governor said that rates were one of the issues to talk about and that we needed a sustainable revenue source. So as I said at the beginning, whatever comes out of the special session on the expenditure side has to have revenues to match up against it. And that can be MCO or another revenue source. And that will be part of the discussions through this whole process.
Thank you very much.
Senator Mitchell.
Thank you very much. Inquiring minds want to know what it means to be crunchy. You have to give us a definition at some point.
There we go.
Based on my assumption, I think I stay crunchy most days, but I don't want to assume.
I got to say, I love your crunchiness,
Okay.
so it's good. It's good.
But don't be crunchy. Don't
All
be
right,
like
hey,
me.
there we go.
I just thought I needed to ask the question that we were all thinking, Mr. Chair.
Yeah, I was thinking the exact same
Yeah,
thing.
just
I need to
crunchy.
know what crunchy is. and
Yeah.
I bet you it's going to be tweeted as we say.
Thanks.
There we go. Crunchy, that's a new
Things
word.
that make you go, crunchy. Thank you, Mr. Chair, for inviting representatives from the administration back up, because we had a discussion at the last full Senate Budget Committee meeting, and which made me go back and really want to ask the administration what is the nature of their apparent historic concern about directing savings from developmental center closures back into both regional center services and community services. We had lengthy conversation in budget. Two subcommittees came up with language really trying to redirect those resources, not just into general fund, but directly into, much like a local control funding formula, let the money follow the client directly. And it was clear from the Department of Finance at that point that that was not your vision. So can someone enlighten me? What's the problem with that concept?
Hi, Teresa Calvert from Department of Finance. I think when we look at savings from general fund from the system, it is just that it would go back to the larger general fund and then be wrapped up in the larger general fund priority discussions that go through the budget process. We have, twice a year, an estimate that comes from the Department of Developmental Services to look at the various components in their department, and that's wrapped up in the larger general fund discussions as well.
And that's because that's your general practice, any general fund savings, any state investment in any state funded program is general fund dollars. And so that's your general practice.
And I'm not
any savings in a particular department should go to general fund as opposed to being targeted?
I'm not aware offhand of instances where we've earmarked savings from a particular area and redirected that back into another related area. But again, it is part of the larger general fund, that can be used for a number of high priorities across all the program areas.
I think that would be something that would be important for the legislature to really look at and ask the question to see if there's any precedent, because as I just thought now, the whole focus of the local control funding formula concept was to direct much needed services to a population that had been left behind. I mean, that was the administration's concept, the administration's idea about how to close the learning gap. And so I think it would be important, as maybe in the context of the budget, that we look back historically to see if there's any specific correlation, because clearly the legislature has expressed its desire, and it seems logical to us. And so I hope that that's something that we can continue to evaluate. And I know there was lengthy conversation about the two concurrent stakeholder groups. And I guess I have a concern if it indeed is the administration's expectation that no action take place around any rate increase or rate adjustment until the work of those stakeholder groups is complete. Because I have served and devoted probably years of my life to state of California sponsored stakeholder groups. And I could probably count on one hand outcomes that ultimately led to policy change. That's why I ran for office, because stakeholder groups were making me old prematurely. So is it your expectation that we not take action until the stakeholder groups have finished their work?
No, that's not. They're not going to be, the task force isn't going to be done in time for this special session.
Okay, thank you. Thank you, Mr. Chair.
Thank you. I believe we have Senator Nielsen, and then Senator Pan, and then Senator Morlock.
Well, on the most recent point, it concerns me that we're trying to cram a lot of stuff into a special session wherein we do not have enough time to do it. Now, I expect this can extend into adjournment this year, but is that what Finance expects that we're going to do? Or are we planning to get this done before we adjourn in a week and a half?
I don't know that the administration has, you know, we've called, the governor's called the special session, you've convened, it's going to take what it's going to take. I don't have a particular time frame, you know, of whether before adjournment, after adjournment.
Yeah. Well, I just view this as problematic and possibly rushing things a little bit too much. Mr. Sue, you talked about the rates being adjusted periodically. So much of what we're discussing here is about rates. The rates being periodically adjusted, is that by the department itself, or is that, as you're suggesting, by action of the legislature?
Under the draft legislation that was put forward in the administration's proposal, the authority to adjust the rates in order to comply with federal requirements would be delegated to the Department of Healthcare Services. So every year, as part of the annual budget process, in terms of the Medi-Cal budget, they would outline any proposed differences in the tax tiers.
But subject to the action of the legislature, correct? They cannot independently raise the rate. You say in the budget. That would imply that as the governor submits it to the legislature, then the legislature is the final determinant.
I believe the draft legislation actually delegates the authority to the Department of Healthcare Services. So they would just submit the new tax tiers as part of the informational process in the budget process. But we'll have to get back to you after a closer look at the legislation to make sure that formal authorization by the legislature is not required. But that's my understanding.
That's an extraordinarily important point. The legislature has abdicated too much authority to agencies to raise fees, to raise fines, to raise rates. And I'm saying, whoa to that. We need to take another look. Then last inquiry, and it's been belabored here, but we've been down this trail before, the deinstitutionalization of the various institutions that happened in the late 70s, early 80s. Are we certain that there's going to be enough community resources available to accommodate the populations that will be coming out into our communities? Mr. McGuire's been asking a lot about that, and I am sympathetic because I used to represent that area too, and I know I came around when that last series of deinstitutionalizations were occurring, and it affected a lot of people, including the families of the individuals who resided there. Do we have the time?
Senator Nielsen, members, John Doyle, Department of Developmental Services. There's no question that, 3.5 years to close Sonoma is, it's quicker than the timeframes we had set at other developmental centers. We have learned lessons in the closure of Agnews and Lanterman Developmental Center. We are working with the regional centers, and we have begun looking at what types of housing resources will need to be developed. But there is work to do in the community, there's no question. But we feel that working together with the regional centers, we think we can accomplish the closure. We, as Undersecretary Wilkening said, our priority is the health and well-being of the residents who live at Sonoma as they transition out in the community.
Well, thank you for your sensitivity, and that is a very critical point. I would just observe at this point to the members of the committee what an enormous burden we face. Kind of a tough timeline, a huge part of the budget, a lot of concerns about the future obligations that we're going to be experiencing, making decisions about. It's quite an interesting and challenging time for all of us, Mr. Chairman. Thank you for your leadership.
Thank you. Senator Pan.
Oh, thank you. I guess, first of all, in this whole discussion about DD and the closure of centers, and I mean, one of the things that I hope we keep in mind, and I realize, when we talk about budgets or bills or so forth, is that really when we talk about alternatives, I'm going to assume that one alternative we don't consider is that we're just not going to provide any services at all, right? Move that off the table. But that when we compare, let's say, IHSS or developmental disabilities, well, yes, money can just, we have a savings, just put it back in the general fund and said, we're going to reprioritize that in the part of the larger whole. And, look, I do think that we really need to seriously think about what trade-offs really are, right? I mean, if we don't do let's say we reduce funds for IHSS, or we don't take it, we're moving people out of development, that those funds, yes, they quote get the general fund, but really what happens is that, the alternative is what really is the alternative, and how the money flows. What is the value of the different things we're doing and the impact they have. So I hope that it's not just like, oh, well, okay, here's an opportunity to save money, we're going to put some more money in the general fund, because what we're really talking about is that as people's lives, and even from our perspective as the policymakers, we're talking about what kind of choices we're making, not just in terms of dollars, but also in terms of quality services and so forth. So I just hope we really keep that in mind. I'm very concerned about the idea that what happens is that we start looking at these only from the dollars perspective and not from the quality of services perspective. And actually related to that, in all the discussion by my good friend and colleague, Senator McGuire, about crunchiness, I was hearing about developmental centers in Sonoma, right? And we're talking, I think, how many people are in there right now? 410, right? And I heard them described as medically fragile, which they are. And certainly, we need to work on the housing and vendors as well. And I'm also sort of looping back to the Medi-Cal rates and what kind of medical services they're going to need. Are they just going to get folded into a managed care plan? Are they going to have the specialty services they need? Because when we're talking about rates, it's not just about how much we're paying the doctors and the hospitals and the therapists and so forth. As policymakers, it's really about access, right? We're not just interested in just being sure doctors get paid a little more. I mean, that's not really the driving force. It's really about access. If you can't find a doctor, you can't find the physical therapist, you can't find, because they can't afford to take care of it, the dentists. I mean, right now we're struggling with the fact that we don't have the payment in Medi-Cal, and actually related to dentistry, but for OR time, so it's technically that's the Medi-Cal side of time, for people with disabilities who often need sedation, they can't get OR time to get that. And actually it's the developmental centers, actually the regional centers who have the patients they're trying to refer to get the dental work who can't get it because you can't get OR time for the dentist to be able to do the work, right? And we're trying to struggle with that here in Sacramento, but actually it turns out the hospitals are doing that. We're serving actually all of Northern California, not just Sacramento County or the immediate counties. So these all have very large ripple effects, and certainly very concerned that we had the auditor take a look at not only dental, and we've had hearings on that. I'm not going to reiterate that, but then there was another auditor's report looking at the networks and the accuracy of the information the department has on networks of physicians And it's very concerning because we're, in some senses, I'm afraid we're running a little blind too, because we're not getting good information and data here about what's going on. So these are all interlinked issues. So, I mean, we sort of talk about, we have IHSS and we have DD here, and we're talking about Medi-Cal, but these are all interlinked because they're often the same people getting hit multiple times, multiple services. Not going to do well if you can't get good housing, you can't afford housing. Not going to get well if they can't get the vendors to take care of them, right? And that's going to impact their healthcare costs too, and the type of, and the healthcare they need. So these are all interlinked. And we really, and when we talk about, and certainly I appreciate the presentation, we're often now talking about resources and money and how we're going to try to find some of those, but we also need to think about, you know, how these interweave, and also to start thinking, maybe also touching a bit about how do we reduce costs as well for people who are trying to provide some of these services. Are there things we can also do as well to reduce some of those costs, but also be sure that we are actually assuring quality. We don't just simply defer to something else. We're going to take those 400 people in the developmental center on the medical side, so we're just going to roll them into a managed care plan, and now it's a managed care plan's problem, right? And our hands are now, we're washing our hands of it, right? Because that's their problem. We have a contract with them. It's their problem now. That we need to be sure that they are actually getting access to all the specialists they need and everything else that they're supposed to receive on the medical side, if they're because they'll probably still be in the Medi-Cal program. And I want to be sure that we have mechanisms in place. So in addition to just, you know, saying that we're going to deal with rates and so forth, we also need to have mechanisms in place to assure that the quality is there. When we talk about reassessing rates or so forth, the assessment should be, are people getting the access? Are people getting the quality of care? What is that level of quality? And if we're achieving the level of quality, you know what? If the rates are low and we get the quality and access, that's not a big problem for me. All right, the rates should be what they are needed to achieve a level of quality and access. And that really should be how we drive these things. Thank you.
Senator Morlock.
Thank you, Mr. Chair. Mr. Martin, have you visited the developmental centers in Sonoma?
I visited Sonoma Developmental Center about a decade ago. I've also visited Porterville Developmental Center, Agnews, which is now closed. Yes.
But not Costa Mesa?
Fairview?
Sorry, it's
No, I have
located-
not.
Okay. I'm just curious, you're talking on page 9 about developing new community resources, and the plant for Fairview is rather large, and I just wonder, has the idea of building a group facility on campus been considered?
I believe so. I think the department could give you a
Great.
better response on that than I could, though.
Okay, you're chicken, that's fine. Or you're crunchy, excuse me.
Senator, there was trailer bill language included that will allow for the development of an integrated community housing on the Fairview Developmental Center property. It's similar, if you're familiar with the property, you may be aware of Harbor Village. It's a
I live right next to it.
It's an integrated community that's on the property.
Okay.
There is, we now have authority, statutory authority to go forward with a project to develop a similar type housing on the property.
Okay, so the way I read the trailer bill, it sounded like you would sell and buy other properties to build the community centers, but you're actually looking at on-site.
The language that is specific to Fairview Developmental Center would allow for the project to be developed on-site.
Thank you. Mr. Sue, did you prepare the graph on page 8?
Yes, our office put that graphic together as part of our analysis of the MCO tax proposal.
So that wasn't a direct answer. Did you prepare this graph?
Yes, I was the analyst who was in charge of doing the report, so I compiled the graph.
Because I want to use your expert analysis, because you didn't comment on it very much. So just a couple of quick questions.
Sure.
Are county-operated health systems included in these plans?
Yes. Now, we have a couple of, more than a couple of footnotes on this figure here, but one thing to note is that we are excluding 11 MCOs with, very few numbers of enrollment, just because, visually, they would be so small that we couldn't actually depict them on the graph. but county organized health systems definitely, at least some of them are on the displayed in the figure. And because county organized health systems, for the most part, do purely Medi-Cal, in the rubric of our graphic, they would be plans that have a completely light shaded area on each column. Yeah.
Okay, then the dark shaded would be the next question.
Yes.
What does, as an analyst, what does it tell you that the top MCOs don't really do any Medi-Cal at all?
Well, it just reflects factually in terms of the healthcare delivery landscape that some of the largest HMOs licensed and regulated by DMHC in California do proportionally less of their business on Medi-Cal and rely more on contracting for commercial health coverage.
So what can you pull out of that? What do you tell a layperson, or what do you tell a professional that obviously you're going to be much more, I'm going to assume you're going to be much more successful if you don't do Medi-Cal. Is that incorrect, or is it just a coincidence?
My response would be more the latter, just based off of just displaying the information descriptively. All we can draw in terms of conclusions are that the larger health plans tend to do, as a portion of their business, less enrollment in Medi-Cal. Now, whether that's a correlation or a causation with the business model that makes a plan more or less likely to make the dollars and cents out of contracting with Medi-Cal, we can't really say from just this analysis.
Okay, then Ms. Bella, on page one, you gave us numbers. You said funding for IHSS was $1.8 billion, and X amount came from federal, X came from counties, X came from state.
Right, I can recap that for you.
You were reading it, and I didn't have it, so I didn't get it fast enough.
Yeah, I can recap that for you. So for the 15-16 year, total funding is about $8 billion for the program. $2.8 billion of that coming from the general fund.
2.8 general fund.
About $1 billion coming from counties, and the remainder coming from the federal government.
Okay, and coming from counties, the next question on your page 13, you have the implementation of anti-fraud activities. And as a former supervisor, IHSS almost seemed wrought with fraud. You know, you charge all your time for going to the grocery store, and you were getting your own stuff, and oh, by the way, I was getting food for my client. What benefits have you derived from the implementation of anti-fraud activities?
I think at the time there was no real formal analysis that was able to show us at the analyst's office that there was this type of fraud going on in the program. I think, you restated some allegations that were made at the time, but to us there was a real question mark on sort of the level or if that was happening at all. But setting that aside, at the time, some context for what you're seeing in the 2009-10 action was that there was a sort of a laundry list of various anti-fraud activities that were put into place, and the estimated solution value was just this assumption that 10% of program costs would be reduced. And a lot of these strategies were implemented in the meantime since then. And it's very difficult to determine whether or not these activities actually resulted in the savings you see here, mostly because so many different changes were happening at the same time. It's hard to sort of parse out whether or not this was, any of the anti-fraud activities actually resulted in this type of savings. The other challenges here, you're really talking about avoided costs in many situations rather than actual savings. So by having a robust program integrity plan in place, you may make it so that people don't attempt to commit fraud in the first place. And so that's very, very difficult to capture.
So the anti-fraud efforts were done by the district attorney's office of every county?
There was some of that, and actually it's my understanding that that's no longer happening. There was a subvention that was actually about $10 million going right down to the district attorneys back in 2009-10. It's my understanding that's not happening anymore.
So then who's doing the investigation?
The counties are doing a lot, and the State Department of Social Services oversees that and has some role in that too. There, they'll do such things as run reports to see which IHSS providers are claiming very high hours every month to see okay, this person worked 300 hours, but where are their clients? Is that a reasonable amount of time for them to be claiming? And those types of administrative reviews, but they'll also do things like home visits, telephone calls. They made it so that when you submit your timesheet, you're signing it under penalty of perjury, and those types of controls were all put into place as program integrity measures.
So if the county is paying 1/8 of the cost, but 100% of the investigation costs, so what motivates a DA to spend time in this area? Does the state reimburse investigative costs, or do you get to kind of get a finder's fee or a benefit from any?
If I may, Senator, Will Lightbourne again from the Department of Social Services. The construct the counties are now under fiscally since the 2011-2012 budget period is a maintenance of effort. So they're, with the exception of increases in wages and benefits that a county bargains, they have a capped finite cost of the program, which increases by a fixed percentage every year, regardless of caseload interaction or change. The county's administrative costs are fully now sort of absorbed within that. So if a county chooses to expand its program integrity efforts directly through the IHSS administration of the program or through reimbursement, intergovernmental agreements, they're free to do so. Again, as Ms. Bella Navarra indicated, the sort of major focus of the anti-fraud efforts was both to put in place sort of preventive measures, do tracking, and then at the Department of Social Services, we sort of do monitoring with counties on their, how they're utilizing tracking data, information as to when a client may be recorded as being in a hospital, but are hours being claimed, or client or provider showing up on mortality tables, death registers, et cetera. So, and we also do targeted mailings to providers and clients, reminding them of the program integrity obligations and the consequences in terms of exclusion from the program for violations. Immediately following the implementation of anti-fraud activities, as Ms. Bella Navarra said, there were a number of changes going on simultaneously, so it's sort of not possible to attach a sort of causality to changes or reductions in participation. Caseload was fairly flat at that period. It was also the period of extreme fiscal stress for counties. Counties weren't fully staffed. They weren't probably doing eligibility enrollments as timely as previous and since. So again, there is sort of interactive set of factors, but within the overall construction of the program, frankly, there has never really been the identification of the incidence of malfeasance, misfeasance that was suggested or alleged at the times. And we still continue our monitoring activities, and they're robust, and counties have the option to increase them.
Thank you. Can I pick on anybody else? No, I'm fine. Thank you, Mr. Chair. Thank you, everybody, for letting me ask some questions.
Thank you. I believe Senator Leno.
Thank you, Mr. Chair. I have one comment to make and then a question for Mr. Martin. I want to thank our colleague, Senator McGuire, for your questions, also your tone, which is always respectful, but you raised a lot of issues that we all need to continue to keep in our focus. And before this special session's out, we may all need to get a lot crunchier. So thank you for that. For us to have included the developmentally disabled community in the title and in fact of the special session, we have, as Senator McGuire suggested, set expectations. And I just think we need to be aware of the fact that whether one way or another, new revenue, existing revenue, one way or another, we will have failed in our mission if we do not make some respectful restoration of the cuts that we have already made. That I think just has to go without saying, because otherwise, why did we raise the expectations? Mr. Martin, with regard to, and this is something Senator Pan raised, with regard to access and quality of community-based developmental disability services, are we moving in a dangerous direction in the eyes of the federal government? The risk of not having a strong community-based infrastructure as we move away from, at their insistence, the state delivery of services?
So one of the issues that I raised when I was giving my presentation was that the federal government is imposing new regulations regarding the home and community-based services waiver. And they're moving away from saying, well, you know, you're living in the community if you live in this geographic area, and more towards an outcomes-oriented measurement of quality. So I think if you're looking at things strictly from the federal perspective, I know that we are now working towards developing a plan to comply with these new federal requirements. I'm not in a position to assess what the risk is of losing federal funds if we're unable to satisfy the federal government at this point. I believe we have a couple of years, though, in order to get into compliance with the new regulations.
I appreciate the comment, and I don't doubt your assessment that we do have some time, but our risk is that in that span of time, things are disintegrating as we speak. And that infrastructure, I think if we don't take some action in this special session, are at risk of dissolving that much more quickly. Thank you, Mr. Chair.